Hello everyone, welcome to this session. You have made a good decision to come here because we will have the opportunity to get more knowledge about the airway clearance impairment in people with chronic obstructive pulmonary disease. I'm Beatriz Herrero-Cortina from Spain, and I'm chairing this session with my colleague that I'm going to give him the opportunity to present himself.
Thank you very much, Beatriz. I am Claudio Rabec. I am a pulmonologist and intensivist, and I work in the Lausanne University Hospital in Switzerland.
So, Claudio, please, if you want, we are going to start with the first talk entitled Physiology and Pathophysiology of Bronchial Mucus. You can start.
Thank you very much. Thank you to Physiosys to invite me. Thank you to you for being here.
I will speak about physiology and pathophysiology of bronchial mucus. And the first thing to underline is that the lung, this respiratory system, is always in contact with the environment, but at the same time need to be protected against this environment by remaining sterile, at least in the distant part of the system. So that's my conflict of interest. That's my acknowledgements. So the normal airway clearance is crucial in protecting the lung, but at the same time in ensuring that the respiratory function is correctly performed. And there are three keys in this normal airway clearance. The first one is the mucus production. The second one is the ciliary activity, and the third one is the effective co-reflex. And all must function synergistically to ensure a good airway clearance in the patients, in the normal subjects. So the first one of this issue is the mucus production. That is a physiological function of the airway, and this mucus is committed to lubrify the airway and to impede that the noxa of the environment affect the lung. So this mucus will dilute the noxas and the strain and the bacteria and allow to eliminate this external noxa. And this mucus production is provided by cells that are in the bronchi, and is more in the upper and lower airway, where this function is ensured by the respiratory system. The mucus has a normal composition, and this normal composition of this mucus is related to two different elements. The first one is a protein that is mucin. The second one are electrolytes, and this equilibrium is very important to ensure a good quality of mucus. When the mucus is with some of the component of the mucus, as the mucin is increased or the amount of electrolytes is altered, there is a diminution in the quality of mucus with the possibility to the stasis of the mucus and the generation of mucus obstructive lung disease. This is the most important thing in the distal airway, but even when the distal airway is not so healthy, the cough could ensure the elimination of this pathological secretion if it's effective. But in some cases, this stasis is so important and stay in the distal part of the airway, and it's not possible to clear this secretion. So this condition may lead to accumulation of mucus with obstruction of an infection. That are the most important consequence of that. And this combination could lead to respiratory disorders that are both infectious, are not infectious, but also to alter clearly the gas exchange in the lung. But about this airway mucus function and dysfunction, this is altered in different situations. In asthma, for example, if there is an increase in mucin, is the same in COPD, but the most severe model of that is in patients with cystic fibrosis, in where not only the mucin is increased, but also there are inflammatory cells in a big amount, but also some products that are nocive for the clearance, that are DNA and proteins, and of course the colonization of the bacteria, that is at the same time a consequence and a cause of aggravation of this mucociliar function. The second issue that is important is mucociliary transport, and mucociliary transport is also a physiological physiological condition that allows to move the secretion from the distality to the proximality in the distal airways. That is, there is a continuous movement of the cilia that are in the surface of the cells that allow to eliminate, to clear the distal airways and to ensure that the noxa and the foreign body are eliminated after then by the CAUG efforts. And concerning this CAUG is again a very important physiological function and need to have three different conditions. The first one is to have normal inspiratory muscles to inspire deeply, normal expiratory muscles to expire actively, and the glottic closure that generate this pressure that allow the secretion to be expulsed by the body. And this is important because this CAUG could be altered at different disorders and different conditions, but also in different parts of the reflex. There are some patients that lack for inspiratory function, the patient that lack for expiratory function, and the patient that has bulbar dysfunction and are not able to close the glottis and to generate the expulsive force to eliminate the secretion. So this is a schematic image of the CAUG reflex. The first thing is irritation. Irritation is maybe related to several things, noxa, foreign body, etc., etc. But the first important issue is inspiration. So we need to have normal inspiratory muscles to CAUG. The second one, we use expiratory muscles that are not used in physiological respiration, but only in some conditions as CAUG, and closing the glottis to generate a compressive phase. After then, the glottis opens and there is expiratory and expulsive phase. And we can measure the efficacy of the CAUG by using the peak flow or the expiratory pressure. The most sensitive one is the maximal flow, the peak flow, that we can evaluate with the CAUG peak flow, that is a peak flow during CAUGing. And in this measurement is very important to evaluate what is the potentiality of having complication related to a non-effective CAUG. So, if I summarize my previous data, there are some causes of impaired clearance. The first one, of course, is the mucus hypersecretion that is characteristic of certain disease, as for example COPD or cystic fibrosis. But not only the hypersecretion, but they see the condition of the secretion that are not good, that is thick and tenacious. The ciliary dysfunction that is characteristic for some disorders, but especially one disorder, there is the immobile ciliary disease, that is a congenital disease. The CAUG that could be weak or absent. And after then, of course, as you know, for receive the air in the alveoli, the air must be humidified and heated at 100% of relative humidity and the physiological temperature. When the patient has an artificial airway, mechanical ventilation, a tracheostomy, or an endotracheal tube, this mechanism is altered, and there is an alteration of the clearance of secretion related to the lack of humidification and heating of the air. Some examples of alteration of viscosity of secretion, as you see, a lot of respiratory disease generate this abnormality in viscosity of secretions. Again, cystic fibrosis and primary ciliary dyskinesia, that is the cilia that are not moving, are the most important consequence in this issue. And the mucociliary transport is altered even in patients that smoke but are not COPD. That is the fact to smoke alter clearly the mucociliary transport, and the most the patient smoke, the most is the impact of the tobacco in the mucociliary transport. Concerning the cauchy impairment, there are different diseases that could explain that. The first is the lack of sensibility, thus the irritation doesn't exist. The reduction in vital capacity that is characteristic for some neuromuscular disorders or neurologic disorders. The compressive phase that is characteristic also in some neuromuscular disorder with impairment of the vulvar function. And the expiratory phase, in which the most important issue is the loss of the activity of expiratory muscles. But also, the secretions and the airway obstruction could explain a reduction in this expiratory phase, even if the expiratory muscles are active. So, in the expiratory phase, when the patient, for example, has an obstructive disease, the patient can generate perfectly normal expiratory efforts, but without producing effective cause. So if I am clear and synthetic, the two conditions that could impair our clearance are characterized by the phases of this scleral impairment. The problem is in proximal airway, that is the secretion stay in the proximal airway. This is clearly related to neuromuscular disorders. And if the problem is the distal airway, that is a mucus cavity or mucociliary transport or the size of airways, in general, this is characteristic of patients with intrinsic bronchi or pulmonary disorders. And these two conditions are different in terms of the management of that, because in the first one, we need to improve cause, and the second one, we need to improve the quality of mucus and the clearance of the distal secretions. So what are the consequences of this impaired clearance? Of course, the most important one are respiratory infections and the mucus impaction. We will speak about that after. This mucus impaction could lead not only to atelectasis, but also to impairment in gas exchange without atelectasis by altering the distal function of the bronchi. Dyspnea is a consequence. This is related, and we will see after then some papers with increased number of exacerbation and hospitalization, and in some cases, in proximal airway dysfunction, and the patient is not able to defend yourself again the environment. There is the need to perform a tracheostomy to make aspiration in the upper airway. What about this mucus plug and mucoid impaction? Classically, you know that mucus plugs are related to atelectasis, that is to obstruction of the upper airway, of the large airway, and non-ventilation distally to that. And this is clearly a problem in those patients. But this is not only the mucus plug. The problem is also, as you can see here, I don't know if you see the arrow here, yes. In the distal airway. And now there is a paradigm change, and the importance of this impaired mucus clearance in the distal airway is more and more important in clinical practice, and have has a lot of consequence. And most of therapists now, most of innovation in therapies now are committed to fight against this obstruction, this distal obstruction of the upper airway. So this is clearly the example of a large airway that are obstructed. So because the mucus that is adhesive and the patient is not able to generate a good pressure, there is an adhesion of the mucus in the upper airway, and after then there is not only impaired dyspnea that generates dyspnea, but also can generate the obstruction of the airway and post-obstructive atelectasis. But not only these mucus plug are important, also these distal mucoid impaction are very important and could lead to to reduction in expiratory airflow with increasing airway resistance, air trapping, worsening of the V-Q relationship, and led to hypoxemia, and also to alterations in pulmonary function test. So this is some papers that I show with that we call the mucus plug score. That is an index that allows to calculate the number of units that are occluded. And as you can see here, as the patient is more severe in COPD, it's most important to have a mucus score that is higher. It is the same with in this graphic at the left that show that the calculation of the mucus score is related to severity of COPD. So this mucus impaction not only is a consequence of the COPD, but this is a cause, is a cause of impairment of the upper airway obstruction, impairment in blood gases, and impairment in prognosis, and happening prognosis impact. So the importance of this sealant airway mucus plug in COPD, distal mucus plug, is more and more found in the literature. As you can see here in this paper published in Chest last year, there is clearly when the patient stops smoking, there is an increase of mucus plug and an increase of mucus plug clearly. And this mucus plug index is related also with exacerbations, i.e., this is a retrospective study published last year also that showed that mucus plug in those patients by using again the mucus plug index is related to exacerbation, that increased exacerbation. And of course, as there is an increasing of exacerbation, there is an increasing of morbidity and mortality in those patients. That's clearly in COPD patients, mucus plug score is related to mortality. So this changed the paradigm in COPD patients, which we spoke about before, about the proximal obstruction. But now we are focalized more and more frequently to the distal obstruction of the airway. And this vicious circles of increased mucus production and decreased mucus clearance led to consequence in terms of morbidity and mortality, not only in patients with cystic fibrosis and other muco-obstructive disease that are classical, but also in COPD patients. How to assess that? Clearly, clinically is possible because the patient is not able to expectorate. The auscultation, you can feel the crackles and the rhonchi, and imagine now the more and more frequently we calculate the mucus score, and of course the presence of atelectasis. We can evaluate also the proximal upper airway function by using the peak flow. When the peak flow is below 240 liters per minute, normally it's more than 360, the patient has an impaired clearance of secretion in the proximal airway, and when this is below 180, the patient is at risk to have pneumonia and respiratory infection. In some cases, of course, we need to have bronchoscopy, but with the new methods to improve clearance, the bronchoscopy is less and less frequently used in those patients. So what are the techniques that we have now to impede to perform this bronchoscopy and to improve this cough flow augmentation and to mobilize secretion? We can use IPPV, that is pressure in the airway, positive air pressure in the airway, but mechanical insufflation or percussion. We will speak about quickly about each one of these methods. And when the problem is in the distal airway, we can use the high flow nasal therapy, oscillations, or intermittent intrapulmonary deflection technique. That the only device that it's now present in the market is the Simeox. So cough flow augmentation, we can do that with manual insufflation, but the non-invasive ventilation, IPPV, or that air stacking, that is to stack tidal volume until the total lung capacity to improve the expulsion of the secretion. But the most important and the most useful device is the device that we call mechanical insufflection. That there are some devices in the market that perform that. That the efficacy is almost exclusively in proximal airway obstruction. So in patients that need to have a support of inspiratory and expiratory muscles, but this is not effective in patients with distal secretion. Another technique that could act more or less well both in proximal and distal is the percussive ventilation, that is to give pulses of low pressure to mobilize the secretion. Is especially useful in the peripheral airways. This new technique, that is the intermittent intrapulmonary deflation technique, that is called Simeox in the market, allow to apply an oscillatory flow during exhalation and mobilize secretion. It's a very innovative technique that performs very, very well in clinical practice, and there are some trials that support the usefulness of this technique in patients, mainly in patients with distal obstruction, problems in the airway. High flow nasal therapy, how now emerged also as a tool, very interesting tool, to increase the mucociliary clearance, especially in patients with peripheral difficulties, by improving the mucociliary clearance. And there are a lot of papers that emerge now in the literature about the efficacy of this technique, not only to improve oxygenation, to improve humidification, to improve CO2, but also to improve mucociliary clearance. Summarizing, secretion clearance is vital in patients with acute and chronic respiratory disorders. Airway clearance is impaired in patients with respiratory disease for different etiologies and the different steps in the airway, both in the upper and the lower airway. And to understand the mechanism, it's important to determine what is the optimal treatment. We have nothing to do with a cough assist in patient that has distal obstruction, because the patient is able to cough, but the secretion are distal, so are not possible. It's not possibility to expulse or to eliminate these secretions. When the proximal airways is affected, the most important issue is to use devices that allow to us to improve the cough reflex on the cough efficacy. When the distal airways are affected, we need to improve mucoscality, mucociliary transport, and to change if possible, the rheological characteristic of the mucus. And after then, to remove mucus plug and mucoid infection. Thank you very much.
Thank you so much, Claudio, for this nice presentation. Right now it's time for our second speaker. I have the pleasure to introduce Alexander Kania, specialist in internal medicine and pulmonary disease, and he's vice president of the main board of Polish Respiratory Society. You can start.
Good afternoon. Thank you very much. Thanks a lot. It's for me a real privilege to be here, and I am very glad that you are here with us. To tell the truth, when I was asked to prepare summary, I realized that when you are well-mannered, summarizing is final slide of presentation. My role is to give you summarizing for 15 minutes. And I agreed for that because I do understand that we are in specific moment of history of physiotherapy. I think that on one hand, we do realize that it is not possible today to treat patients effectively without physiotherapy. On the other hand, we do know that we still grow evidence about that. That is why please give me this time to describe you what happened in April 2025 in Hradec Králové in Czech Republic, where experts took part in a roundtable and discussed Simeox. It's my conflicts of interest. Starting with introduction, I think that we do know that among available airway clearer techniques, Simeox therapy appears to possess distinctive properties. That is why leaders who used to work with patients and physiotherapy decided to meet and discuss the latest advancements in Simeox airway clearance technique, and they tried to show its clinical applications. They shared not only their clinical experience, but discussed best practices. And they tried to provide recommendations to know how to use Simeox in treatment of different patients with different diseases. We met together having experts from Switzerland, Poland, Czech Republic, and Slovakia. At the beginning, I want to highlight that these experienced people were of opinion that this shown vicious cycle is very important. And airway clearer techniques are a cornerstone in helping clear mucus in chronic respiratory illness associated with overproduction, retention of mucus. What is important, we still should be very patient and know that we should think not only about classic bronchiectasis patients, but also about patients with different diseases, like COPD, asthma, or even interstitial lung diseases patients where bronchiectasis can coexist. Infections commonly occur among these patients, and this vicious cycle which you can see here is a process which can be effectively stopped using airway clearer techniques. As I've told, we have different techniques and we still need evidence to optimize their potential, and we try to do that, and as we know as well with Simeox still trials are ongoing to be able to prove its evidence-based medicine effectiveness. We have Bible for this moment, which is, I think, this document. It is European Respiratory Society statement on airway clearer techniques in adults with bronchiectasis, which very, very effectively shows key points. When you look at that, you can read this, what is, I think, the most important aspect when you analyze how important are airway clearer techniques and where is its place in the process of treatment of our patients. We should understand barriers, and we must realize that we need studies, and our future must be concentrated on trials in this area to be better and better every year and to know what and how to be used. What experts from Hradec Králové decided to say to you? They, looking at Simeox, wanted to say that Simeox provides intermittent negative pressure pulses during expiration to mobilize secretions based on the rheological properties of bronchial mucus. What is a benefit? This airway clearance technique may be especially suitable for individuals suffering from breathlessness and fatigue, which limit their ability to effectively clear secretion using conventional techniques. We know from studies for now that Simeox improves muscle clearance, health-related quality of life, respiratory symptoms and symptom burden, helps with patient autonomy and therapy adherence, patient's tolerance, comfort, and patient satisfaction. Experts analyze specific groups of disease. We do know that still a lot of our bronchiectasis patients are idiopathic and we are not able to explain why they suffer from bronchiectasis. And this group of patients is very good group to consider using Simeox. I showed you a document of ERS which discussed adult patients, but in our group had a doctor who has great experience with children, and he proved and showed us his stories about treatment of children where Simeox therapy was also very effective, and this group of children were suffering from primary ciliary dyskinesia. Experts also highlighted how Simeox therapy may help in relieving mucus retention, improving respiratory symptoms, and stabilizing disease progression in cases of bronchiectasis related to pulmonary fibrosis. COPD was a very important topic. I think that everybody every day has COPD patient. Experts discussed how Simeox therapy may contribute to medical management aimed to reducing disease exacerbations, improving lung function, and preventing hospitalizations in people with COPD. So in fact, it is this acting which is a main goal according to God. The Simeox technique is particularly beneficial in clearing mucus from the various parts of the bronchial tree, which is essential for treating respiratory disorders in patients with a high prevalence of mucus plugs or chronic bronchitis. Experts highlighted the therapy's capacity to significantly improve quality of life and respiratory symptoms based on data from a prospective cohort of COPD patients with chest congestion treated during hospitalization for pulmonary exacerbation. Additional data from robust studies are needed to confirm the impact of this treatment on lung function and hyperinflation. Asthma patients were the next group of patients which was very discussed, and experts debated on Simeox effectiveness in severe bronchial asthma. And based on clinical series, the technique may be instrumental in breaking the cycle of infections and enhancing overall disease management for individuals with severe persistent asthma and overproduction of mucus. However, again, further data is needed to support this. Some patients may show a reduction in abnormalities on imaging, enhanced respiratory function, and decreased reliance on antibiotics and better overall disease management. Experts have highlighted the potential effects of Simeox therapy in reducing exacerbations and improving symptoms such as coughing and mucus production that require further evidence from trials. And now let's come back to ERS. ERS experts recognize the value of ACTs and suggest that techniques like Simeox should be evaluated in future studies. Today I can say that is a growing evidence-based medicine data on Simeox, and ongoing studies continue to contribute to the knowledge base. The experts from Hradec Králové believe that their experience, along with real-world evidence, complement the existing knowledge about Simeox. And now is conclusion, summary of key takeaways. The roundtable emphasized the significance of modern airway clearance techniques like Simeox in treating various respiratory conditions associated with mucus problems. Integration. Simeox therapy, a specialized approach, enhances mucus clearance across a range of respiratory conditions. Chest physiotherapy, including Simeox, is essential for treatment individuals with chronic lung disease and mucus issues. Importance of individualized therapy. Incorporating Simeox into personalized treatment plans can enhance symptom relief and improve the quality of life for patients. Thank you very much.
Thank you, Alex, for this very nice and comprehensive presentation of this meeting of experts. The session is open for questions. Of course, if you have the question to ask, you have mic here, 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 and here.
Don't be shy. So I'm going to start, if you don't mind. In fact, I have a question for both of you, because I'm worried about the silent patients, these patients that have mucus plugs in the CT scan, but without any respiratory symptoms, no report cough, no report expectoration, and I'm worried about these patients. My first question is, we need to try to approach these patients and start airway clearance techniques in order to improve the mucus plugs, because we already know that it's a biomarker really associated with worse prognosis in these patients. And for you, maybe airway clearance techniques in these patients are not enough. The traditional airway clearance techniques are not enough, and maybe we need adjuvants for that. And do you think that Simeox, it could be a good option for this kind of patients?
I think that this question for plaques and patient without symptoms is very interesting. Of course, this what I say has completely no evidence. It's my private feeling. But I think that there is a specific group of patients whom I usually very care for. For example, these are patients who are with problems with functioning immune system, patients, for example, while immunosuppression treatment, or patients after lung transplant. It is such a group where realizing that the risk of infection is very high, and that infection can cause a real clinical problem, which will influence on the patient history, is for me a situation when we should do everything to protect the patient against exacerbation. So it would be for me perfect candidate to start working with physiotherapy techniques to make patient situation better, to decrease the possibility having exacerbation. And it is my first comment to your question. And of course, we don't know which technique should be chosen and will be the most effective, but I think that this world individualization and personalized medicine is really very clever for today. And when I am looking at my patients whom I work with, they are different, and their problems with breathing, coughing, functioning is completely different dependent on that who they are and what they suffer from. So individualization here is always standard, which I believe increase level of medical care.
Thank you.
Thank you very much for the question. I think that it's very important to underline that this concept of a sealant mucus plug and the impact of this distal airway obstruction is some new. There are some publications in the last years that underline that. And this look for this obstruction, distal obstruction, is not only related to the impact in morbidity and mortality, but also in pulmonary function. Because there are some papers that show that when you treat patients with cystic fibrosis, these data were published, but also some data that were not still published, but that we know by the posters and the abstracts in COPD patients. There is clearly a crucial improvement in FEV1 in those patients when you treat this sealant mucus impaction. There are a paper published by Claudia that show that in patients with cystic fibrosis, by treating this sealant mucus impact, could improve up to 300 milliliters of FEV1 in patients with COPD that are supposed not to have reversibility with bronchodilators or other therapies. So it's very important in terms of prognosis, but also it's very important because we have now tools to understand if the patient has or not, and very accessible. Yes?
Too close.
Excuse me, I am sorry. But I am very enthusiastic. So, so this high-resolution CT scan with new techniques to evaluate the amount of impact in the peripheral airways is a very interesting and easy tool to evaluate that by most of radiologists now. And this mucus score is validated as having an impact in morbidity and mortality. So it's very important that we change this paradigm that COPD is a fixed disorder, of course, but we have the possibility to do better with some new techniques. And I think that we need to evaluate systematically with CT scan those patients to treat them if they are a mucus score that is elevated by using the new techniques that are very effective in this context.
May I comment it?
Yes, of course.
I will keep distance with microphone. I realized that we discuss COPD, so we discuss progressive disease. We can be sure that this patient will be worse in future. So it's a very practical question. Why not to start physiotherapy earlier? This patient will need it, we are sure. So probably the quicker, the better. Mm-hmm.
Thank you so much, Claudio and Alexander. I think we don't have time for more questions, but I would like to say thank you to PhysioAssist for support these kind of sessions. I think they are really relevant because our clearance management is starting to be a hot topic again, thanks to the new evidence that we have. And if you want, you can try to approach to know a bit more how this device works from a mechanical point of view, and also the potential to use with your patients. And if we don't have any time here, maybe you can approach in the industry area to understand better how it works. So thank you so much for coming, and I hope you enjoyed the session.